We begin the news at 10 tonight with more opportunities to fight the effects of the virus for those who contract it. Well, they're springing up around Idaho. We're talking about facilities using monoclonal antibodies to treat COVID. And now a new clinic called Direct COVID Care has just opened its doors in Boise, and they've already treated dozens.
Doctors at Central District Health say this treatment has reduced COVID-19 deaths and hospitalizations by 70%. Our Tristan Lewis took a visit to the new clinic. He joins us now in studio to tell us more about the center and who qualifies, more importantly, for this treatment. Tristan, what did you learn?
So, Mark and Kim, the treatment is for those who have been recently diagnosed with COVID and first had symptoms within 10 days. The medical director for the clinic says the sooner you get the treatment after testing positive, the more effective it will be.
It's been exposed a few times, but never had it.
Avoiding COVID-19 was something Paul and Suzanne Kraft managed to do throughout a majority of the pandemic. That was until the fully vaccinated couple started experiencing symptoms last week. Paul at the beginning of the week.
Start like on a Monday, and then by Tuesday they were getting just a little worse. Nothing terrible, just a cough.
Suzanne a few days later.
While I'm very grateful that the breathing wasn't an issue, I was having lots of other symptoms that made it, I was worried about where I was headed. I was pretty sick.
When they got the news of their positive tests, a coworker of Suzanne's told her about a new treatment for COVID-19 infected people called monoclonal antibodies.
It is infused or injected into your body. It'll go into your bloodstream and then attach to the COVID virus, and then allow your immune system to take care of the virus.
After getting a referral by their doctor, both Paul and Suzanne went to the newly opened monoclonal antibody treatment clinic in Boise called Direct COVID Care, who is working to treat 100 patients each week.
In our current state of affairs with our crisis standards of care and where our community is with the number of cases we have in the valley, this will help decrease those hospitalization rate and hopefully get us out of crisis standards of care.
Dr. Ryan Williams, the medical director, says this is the first treatment facility in the Treasure Valley that's open to everyone who qualifies. He's hopeful to see what this will bring for the area.
We've treated several pregnant patients, we've treated several older patients, and several younger patients in their 20s that have risk factors, and everyone has tolerated it just fine.
Suzanne, who was treated Friday, was told that she would start to feel better within 24 to 48 hours.
And the biggest thing was the body aches and the nerve pain, like from head to toe nerve pain.
30 hours in, she could feel that difference.
It was night and day difference. Something was working and it was wonderful.
Now, those who do not qualify for treatment are people who are currently on oxygen and are hospitalized because of COVID. Dr. Williams says this is not a substitute for the vaccine. This is just another tool. And he adds the vaccine is still the #1 defense against COVID. Mark and Kim.
You know, if you can keep folks out of the hospital any way possible, you gotta do it.
Tristan, thank you.